Okay, for those of you who can now hear us, all we've done is we've just done a bit of a welcome. I'm just letting you know with Microsoft Teams that if you could please keep your microphones muted the whole time, and if you have any questions, if you could write them in the little question and answer section, and we're going to do all the questions at the end of the presentation so that we keep the recording nice and smooth. Okay, so we have most of our team here tonight. Our director, Dr. Richard Dare, is here, and our Public Health Medical Officer, Annie Preston Thomas, is here, and they're going to be on our panel later. Our CDC nurses are Julie Esmond, Carly Thurwell, who are both here somewhere.
Feeding everyone.
And Shirley McLean and Amy Ryan, they're not here tonight. I'm part of the immunisation team of the Public Health nurses, and so it's Nancy and Nicole Spawn. We have Lisa Maslin here, who's kind of CDC/IMS. And then we have Connecting Our Mob team, which is Nicole Gordon-Cook, who's just down here, and Lisa Luxford's our data officer, who's also here, sign-in sheets. And then most people know Kathy Lort-Phillips, who's our data officer. Kathy was at the sign-in desk, and we have a new data officer called Alyssa Barton, who's not here tonight. So we have quite a lot of our team here tonight, so we'll hope to, if you have any questions, we have quite a few different specialities. Okay, so I'm just going to talk about the influenza program this year. So we're going to look at influenza data. We're going to look at some of the challenges of last year and this year, how we can protect our community, what's new this season. Unfortunately, there's not too much new with influenza, you'll be pleased to know. What's in the vaccine, and also we'll obviously have to discuss COVID-19 vaccine and influenza, how they're going to bring those two together, and what are the vaccines available on the NIP schedule this year, the eligibility criteria, just a little look at possible hesitancy with everything that's happening, and the resources, and just a couple of slides on air because there's some quite big changes to the Australian immunisation register. So this is just some data from, it's the weekly notifications of confirmed influenza from January 2016 to March 2021. And just the reason why I wanted to show you this slide is that generally we have an influenza season from June to September, October every year, with August generally being where we have the peak in August. But in tropical climates, we often have peaks at other times, and we tend to have peaks early on in the year in the tropical climates. And that big peak is a peak from 2019. So that's just giving you an idea of where we tend to get our influenza higher rates. And this is a Kent HHS slide. And then this slide, another more Cairns data. This is from the 1st of January 2019 up until the 7th of March. And it really highlights that huge, massive flu rates that we had in early 2019. And then we had that second peak again later in the year. But then there's a real obvious reduction in the amount of influenza starting in early 2020. And that's when COVID came along, and we were just at that time stopping international flights. There were border closures. We had a lockdown period where schools were closed and daycare centres, no visitors to aged care units. And so all the places where we tend to get the super spreaders, everything was in lockdown. And also when we came out of lockdown, everyone developed their strategies for social distancing. And then you can see as the year went on, our rates just stayed really, really low. So it just goes to show how much all the social distancing methods had such a big effect on influenza. That's not to say that it's always going to stay like that. So the challenges from what we had in 2020, when those rates were flu rates were lower, but you still had to get the influenza vaccine out to everybody. And the COVID-19 pandemic was new and emerging, Social distancing measures were just being created, and everybody did a fantastic job of still rolling out the influenza program. There were people vaccinating in cars, people altered their waiting rooms, people did clinics in the evening to reduce the amount of people in their clinics. It was a big year, and I think everyone just thought, oh, let's get 2020 out of the way. Everyone was anxious, our community was anxious about the pandemic, and we were all just having to adapt. But then in 2021, amazingly, we have a vaccine. There's 2 vaccines that we are having use at the moment. There's potentially more, which is amazing for in 12 months we've been exposed to a pandemic and suddenly having a vaccine. But obviously we've got to roll out this vaccine at the same time as the influenza. Just so happens that they both coincided at the same time. So we'll just have a look at, we'll go through the intervals a little bit later on. And just this time last year, everyone was anxious about the COVID-19 pandemic. And then this year, people are now anxious about the vaccine. Everybody was wanting a vaccine, now we've got a vaccine, and now we've got to try and help people sort of with their education and information, make sure that everyone's well informed about the vaccine. Okay, so influenza, as most people know, it's a respiratory illness that occurs following an infection with the influenza virus. Now, influenza can make you quite unwell, but often most healthy people, it just lasts a few days with fever, aches and pains and a sore throat. But in some cases, particularly in elderly, pregnancy, young babies or immunocompromised people, the influenza can be quite serious and it can cause hospitalisation and can even cause death. So vaccination continues to be the best measure in preventing influenza and its complications. So that's why we continue to roll this programme out every year. And we're a pretty well-oiled machine with doing that. Just something else thrown into the mix this year with COVID. But it's important that everybody still
we can eat now.
Have your mouth and nose and sneezing and stuff definitely stay healthy as well. And hand washing is so important. As nurses, doctors, we've always been pretty red hot with hand washing, but it seems like everybody else is beginning to now, which is good. So what's new with the influenza vaccine program this year? Fortunately, there's not a lot new at all. Everything is very similar to the previous year, apart from the fact that this year we do have to take into consideration the COVID-19 vaccine running alongside the flu program. One other thing that's different is we don't have Fluquadri on the funded schedule this year. It's still available in the private market, but there's no Fluquadri within the Queensland Influenza Program, funded program. And then there's a new vaccine called Flucelvax. It's a newly registered cell-based influenza vaccine for use in adults and children over 9 years old. And this is not available on the funded program either, but it can be, it may be in the fridges as private purchase. So this is what I've taken from the ATAGI statement. Hopefully everyone's had a copy of that by now. And it looks a little bit different this year because it doesn't just give the influenza strains, it says whether it's egg-based or cell-based. So all the vaccines that are going to be on the National Immunisation Programme funded schedule are the cell-based influenza vaccines, other egg-based vaccines. Just the cell-based is that Flucelvax, which I talked about a moment ago. There are similarities in that the B strains are both the same. The only difference is their H1N1 is the Wisconsin strain, whereas the egg-based is a Victoria. And it's pretty similar. I just put what was in the vaccine last year, and it's the same with the Washington and Puget, but the H1N1 and the H3N2, they're both a little bit different from the strains in the flu vaccines last year. So this is what's on the ATAGI statement. This information hasn't changed from last year as well. So with the new manufacturing methods of the vaccines, this is the egg-based vaccines, there's usually less than 1 microgram of egg protein per dose. And recent studies have shown that people with egg allergy and egg-induced anaphylaxis, they've safely received the influenza vaccine. If you have got somebody with anaphylaxis or allergy, they should be vaccinated in a healthcare setting where providers experienced in recognising and treating anaphylaxis, but hopefully everybody's service should be prepared for treating anaphylaxis. And all influenza vaccines on the Australian schedule this year are latex free. It was just a hiccup, it was just the Vaxigrit Tetra in other countries that has some latex in the bungs or something, but it doesn't in Australia. That's all the same advice as last year. Okay, so this year we've got COVID vaccination to think about, and as well as the influenza vaccine. So co-administration of influenza vaccine on the same day as a COVID vaccine is not recommended. Administration of influenza vaccine and a COVID vaccine should be a minimum 14 days apart. And that's just at the moment, there's no safety data on co-administration. So that may possibly change down the track, but at the moment it's definitely 14 days apart with no co-administration. And the ATAGI statement says that influenza vaccine can be given before or after any dose of COVID-19 vaccine with a minimum interval of 14 days. But I've just put a little note there because in the Pfizer hub at the hospital, we're doing a 3-week interval, and Pfizer is a 3-week interval, but it may cock up their timetable if we then go and put a flu vaccine in the middle of that, because if you give it 2 weeks later, then they'll have to wait another 2 weeks before they can have the Pfizer, and the hospital has been quite strict in their appointments that they're doing. So it would be better if you've already started on the Pfizer, it's such a short interval, it'd be better to have the second Pfizer dose before you have the flu vaccine. I'm just going to have a quick sip of water. So with the scheduling, there has been a document, the ATAGI have made a document specifically about the schedule of the influenza and COVID-19 vaccination. And what they're recommending at the moment is that if you're in phase 1A, you should receive the COVID vaccine as soon as it's made available to you, and then receive the influenza vaccine. However, if you're in the later phases of the rollout, COVID vaccination should, you should receive your influenza vaccine as soon as it's made available to you, and then go on and receive the COVID-19 vaccine when it becomes available. There are going to be different circumstances for people, but that's the rule at the moment. And yeah, that's the, I think I printed some of those off. They are down there, those documents at the front desk. It's important more than ever that you check air now, because there are going to be people who may have had a COVID vaccine and you're just about to give a flu vaccine, or vice versa. But it's extremely important to check the Australian register for COVID-19 vaccination prior to administering the flu. And that's particularly so for these groups of people that are in the 1A group. So your aged care and disability residents, aged care and disability staff, quarantine and border workers, frontline healthcare workers and their subgroups. So if they're coming into your clinic or you're going into their service to do a flu vaccine, you really need to be checking air to make sure that you've not already had that vaccine. And we're just going to have to keep a bit of an eye out, because not all the aged care units have been vaccinated with COVID yet. So we're trying to get some more definitive answers about when the dates when people are going to be coming into aged care facilities to do their COVID vaccine. But we'll just have to watch this space with that. But regardless of whether you're given a flu or a COVID, you should really be checking air at this time of year when both are available. So these are the vaccines that you're going to see in your fridges and the funded programme. So you've got Vaxigrit Tetra, Fluarix Tetra, Afluria Quad and Fluad Quad. And everybody who is a vaccine service provider who's here, hopefully you've already received these 2 documents from the immunisation programme. And we've brought them with us as well tonight, and they are online as well, the Queensland Health Immunisation Programme online, and all Queensland influenza vaccines on the NIP this year are quadrivalent. So this is again taken from the ATAGI statement, and this is all the vaccines that are available in Australia this year for the 2021 influenza programme. And the ones with stars are the ones that are going to be Queensland Immunisation Programme funded. So FluQuadri is there, but that's not on the funding, and the Influvac and the Flucelvac, they're the ones that will be possibly on the private market, depends where you purchase the vaccines from, I suppose. So there's four of the vaccines available in Australia are going to be what you'll see in your fridges. This just is a breakdown of who gets what, so it's always a really handy poster to keep on your fridges or next to where you're drawing up your vaccines, just so as you know which age group is having which. I'm going to go through the age groups in just a moment. So 6 months, they have to be 6 months of age, no younger. They have to have reached that 6-month birthday, and they're eligible up until children turn 5 years old. And the vaccines that you'll see for them are the Vaxigrip Tetra and Fluarix Tetra. And then for the older children who are 5 and then adults up to 64 years, there's going to be the Vaxigrip Tetra, the Fluarix Tetra, and they will be able to have a FluRiaquad in that age group. Same as last year, the 65-year-olds and over, they're eligible for the, we expect that they would get the FluAdQuad, which is the vaccine of choice for that age group. I'll go through all those in just a moment. Just a FluRiaquad, as I just said, it is from 5 years and older, and it's not registered for children under 5 years of age. Last year I had a quick count before I came here tonight. We had 5 incidences of it being given to children under 5 years of age, and that requires quite a bit of follow-up. The TGA send a report to us, and we have to do follow-up of those, and it's reported to the TGA. So really check. Some of these names do sound quite similar, so just be mindful of what shelves you keep your fridges on to try and keep that separate. All influenza vaccines for this year are in 0.5 ml, so there's no halving the doses. That's the same advice as last year as well. So our eligibility groups are the same as last year as well. Children aged 6 months to under 5 years, pregnant women at any stage of pregnancy, Aboriginal and Torres Strait Islander people aged 6 months and older, adults aged 65 years and older, and people aged 6 months and older with medical conditions predisposing them to influenza. So for children, just said, have to be 6 months old, no younger. They're only eligible until they're 5 years of age. If they don't fit any other criteria, and the vaccines for this particular age group are the Vaxigrip Tetra and Fluarix Tetra. For children older than 5 years, that they can have either a FluRiaquad, Vaxigrip Tetra or Fluarix Tetra, but they would be having that either privately or if they fit into a medically at risk category, or if they identify as an Aboriginal and Torres Strait Islander. And just remember, for all other age groups that aren't in any of these parameters, flu vaccine is available on the private market. You know, there's no reason why you can't be offering flu to everybody who walks in the door if they're not eligible. And for children that are 9 years of age and under, they need to be given 2 doses 1 month apart if this is the first year of receiving the flu vaccine. So the influenza vaccine, it can be given safely with all of the vaccines on the Queensland National Immunisation Programme. The poster on the right-hand side, we developed that about a year ago when we got the additional vaccines. We got the Bexsero and the additional dose of Prevnar, and people were a little bit uneasy about the amount of vaccines that children get. So if there are enough at the back, if not, just contact us, because it's a really handy poster. It's good to show mums as well when you're just about to vaccinate, if they're feeling a little bit uneasy about the amount of needles that their babies get in. And I just wanted to point out, while I've just got the opportunity, this is our National Immunisation Programme. It's not the easiest of programmes to read. It's a little bit busy, but we are finding that there's quite a few people, quite a few children, the Aboriginal and Torres Strait Islander children, that aren't getting Bexsero. which is given at 2, 4 and 12 months, and the additional dose at 6 months. And then they also get Pneumovax 23 at 4 years of age. Just when we're going through all our overdue notices, we do find that often some of these Aboriginal and Torres Strait Islander children are missing out on these additional vaccines. And also, while I've got the opportunity to say, at 6 months of age, Aboriginal and Torres Strait Islander children don't receive Bexsero, only if they fit the medically at risk criteria. It's been quite a confusing schedule, and we do get quite a lot of questions about that. But they only get it if they're medically at risk. It's an additional dose at 6 months. With pregnancy, influenza is a serious disease for pregnant women and for the fetus and newborn babies. Pregnant women are twice as likely to be admitted to hospital as other people with influenza. It can lead to premature delivery, even death in young babies. And babies less than 6 months of age are more likely to be hospitalised with influenza. This is one of the Department of Health information sheets for parents. I ordered a few, but they didn't arrive in time for tonight, but you can obtain them from the Department of Health. It's a really informative read for pregnant mums. When you're vaccinating a mum, it acts as a 3-in-1 benefit. So it protects the woman during her pregnancy and early motherhood. It protects the young infant by transplacental antibodies, and it also protects the young infant from antibodies in the breast milk. It is recommended in every pregnancy, and it can be given at any stage of pregnancy, and it can be safely administered at the same time as Boostrix or Adacel. So just remember that your DTP can't be given until 20 weeks and over of gestation. So if you've got a pregnant woman who had a flu vaccine in 2020 while she was pregnant, and we roll into the 2021 influenza season, when that flu vaccine becomes available, the woman should receive an additional dose of flu vaccine. So she's getting the vaccine from both seasons. So basically the woman's going to get 2 flu vaccines in 1 pregnancy. That's if it rolls over into the new season for her. If a woman receives a 2021 vaccine prior to getting pregnant and then becomes pregnant, she should be revaccinated in that pregnancy to protect the unborn infant. And pregnant women are funded for either Vaxagrip Tetra, Fluarix Tetra or a Fluria Quad. So Indigenous Australian populations experience higher rates of disease and a greater burden of illness. So all Aboriginal and Torres Strait Islander people are eligible for the funded influenza vaccine. So that will be starting from 6 months onwards. But we do have to be mindful that for Aboriginal children under 5 years, that they get the age-appropriate vaccines, and for Aboriginal and Torres Strait Islander people over 65 years, they must get the age-appropriate vaccine, which is the Fluad Quad. So even though everybody's eligible, you still have to make sure that they fit into that correct age criteria. For over 65 years of age, Fluad Quad is the adjuvanted vaccine that we've used for a couple of years now, and it is specifically designed and recommended for the over 65-year age group. And it's specifically designed to increase the immune system's response to the vaccine, but it is only licensed for people aged 65 years and older. Again, we did have quite a few cases of Fluad Quad being given to people under 65 years. So just try and have that separate from all your other vaccines, so it's nowhere near the vaccines that you would be giving to your children coming in. Because the Fluad Quad is adjuvanted, we did notice that people were getting higher injection site reactions. So just warn your clients beforehand that that may be an issue. Obviously, if they get a real nasty injection site reaction, we want you to fill out an adverse event form. And also, your clinics get quite busy at this time of year with your over 65-year-old ladies and gentlemen coming in for their flu vaccines. So it's a good opportunity to see what other vaccines they might be due. So for 70 years and older, they're eligible for Zostavax if they've not already had it. And I think that catch-up finishes this year as well, because it gave us 5 years to catch up, and I'm pretty sure that was 2021. So just check that they're up to date with their Zostavax. Only one dose. It's a very strong live vaccine, so we do check there that they've not already received Zostavax. And now, from the new schedule that we had last year, we give Prevnar 13 for Aboriginal and Torres Strait Islander people. It's at 50 years of age, and for older, 50 years of age and older, and for non-Indigenous, it's 70 years and older. So we do still get quite a few telephone calls about what to give, but anyone who's 50 years and older, who's Aboriginal or Torres Strait Islander and hasn't had a Prevnar 13 can have one. And the same, anyone who's older than 70 years of age and not had a Prevnar 13 can have one. And then some people may still be eligible for Pneumovax if they're medically at risk. You just have to check the criteria for that. And remember to check air that they've not already had it. And remember that you only have 2 doses in a lifetime of the Pneumovax 23. And then just to note on the bottom, so the influenza vaccine can be safely given at the same time as Zostavax, Prevnar 13 or Pneumovax. And always check the Australian Immunisation Handbook for your criteria. And as I said, can't sort of emphasise enough, check air. This is for the medically at risk. So people who have certain medical immunocompromising conditions are eligible for the flu vaccine. This hasn't changed from previous years. So we've still got cardiac disease, chronic respiratory conditions, chronic neurological conditions, immunocompromising conditions, diabetes and other metabolic disorders, renal disease, hematological disorders, and long-term aspirin therapy in children aged 6 months to 10 years. So you just have to use your judgments a little bit, because obviously everybody comes with different presentations, but that criteria is pretty much the same as it's always been. And that's on the ATAGI statements that hopefully everyone's got an ATAGI statement by now. And so all Australians aged 6 months and older with medical conditions putting themselves at an increased risk of severe influenza are eligible to receive the age-appropriate funded vaccine. So even though they're all eligible, as I said before, you have to make sure that they fit in the correct category for age appropriateness. And yeah, that ATAGI statement is our kind of go-to with the immunisation program. Influenza program, sorry. So the program should start next week for Fluad Quad. So what they're going to do is, I think everyone should have had this information who's a vaccine service provider, should have had the form that has these dates on the back. And there will just be one initial delivery to begin with of influenza vaccines. And they'll be provided by the immunisation programme. They'll take approximately about 2 weeks, and they're going to be starting from the 29th, which is next Monday. So it doesn't necessarily mean you'll get them next Monday, but over that time, you should start to, the next week or two, you should start to get your influenza vaccines. And what they're sending out first is a Fluad Quad. So that's your vaccine for the 65-year age group and older. So as I said, just be mindful of checking air to make sure that no one's just had a COVID vaccine. And then as from Tuesday, the 6th of April, you can start placing weekly orders. And what they have said, if you're just doing your normal monthly order, you can tag your influenzas onto the end of that, or you can just start doing them. There's a section for influenza on the order form. You can add that in there. And those weekly orders won't commence arriving until Monday, the 12th of April. So that'll be another week again. So it starts off pretty slow and then they'll build up. And that second round, you'll get all the Fluad Quad, Fluarix Tetra, Vaxigrip Tetra, and a Fluria Quad. First time we've done education before the vaccines arrived, I think. Queensland Immunisation Programme, this is the website. Everyone who's a vaccine service provider here has probably got used to everything being online now, and that all started with COVID last year. We had your order forms, cold chain breaches now, we want them doing online and emailing to QUIP. And then there's the online courses, which we encourage everybody to do course 2, which is vaccine management. The adverse event forms are on there. And it's also really informative. It tells you all the Queensland immunisation schedule and eligibility, and it's got the whole of the 2021 influenza program on there as well. So it's a real go-to for information. The community is a little bit hesitant, as I mentioned earlier. Everyone was upset about getting a little bit anxious about the pandemic last year, and this year everyone's getting a little bit anxious about the vaccine. We're not always going to have this level of social distancing, border closures and reduced international flights. You know, eventually, hopefully everything will get back to normal or some kind of normal. So just because we've got low flu rates, and people may be aware of that, we don't want there to be complacency. We're also aware that people are probably going to be having quite a lot of visits as well with having the COVID vaccine. That will require 2 visits, influenza vaccine. We don't want that to lead to non-attenders. So we're keen to make sure that everyone attends all their appointments. And it's important that as healthcare workers that we're motivated and project a positive approach to the vaccine, and that we provide research-based information for our patients and also our work colleagues as well. And everyone's exposed to you know, news, social media. Everyone's got information, everyone's got opinion. We all know somebody who's an anti-vaxxer or someone who's hesitant. Let's just try and portray positive research-based information. We've all had our COVID vaccines. I had my second one this morning. Put it on Facebook so everybody knows. So yeah, I just want to try and keep a positive attitude with the world of vaccines. And then there's heaps of resources. I keep mentioning the ATAGI statements. That is basically everything that we need to know. The NCIRS normally update their fact sheets. At the moment, it's still the 2020 fact sheet. Hopefully they'll update that soon. They haven't put an education out yet. They normally put theirs out before we do. The handbook is online now, and that's our absolute go-to for all information as well. That's the online immunisation programme website. And Sky is for any vaccine hesitant parents that you've got. It's got some real good information. There's a few courses on there as well. Almost there. I've just got a couple of slides about the immunisation register because we've got something quite important that we want to say about that. So I don't know who knows, but from the 1st of March, the Australian government has mandated that all influenza vaccinations administered, that's either public or private, must be reported to the Australian Immunisation Register. So there's no excuse now of saying I've not got access. Everybody needs to have access. And so that's the 1st of March, that's already mandated for influenza vaccinations. From the 1st of July, it will be all other NIP vaccinations. So any vaccine that's on any of our national immunisation programmes, it's mandated that you have to put that data onto the Australian Immunisation Register. And back on the 17th of February, that's when COVID vaccination started, and that was mandated straight away, that had to be on the Australian Immunisation Register. So if you vaccinate, you must have AIR. If you don't have a PRODA account, you need to organise yourselves a PRODA account and get that set up for this mandatory AIR reporting. For Queensland Health staff, once you have your PRODA accounts, you need to contact Kathy or Alyssa Larkham, who we work with. I think everybody knows Kathy Lord Phillips, and she can organise that link into HCOS for Queensland Health staff. She's the delegate, I think, isn't she, for that? So, and I keep emphasising it, but AIR, it's so important that you check AIR, more so now than ever. So definitely keep checking. And then Nancy's going to speak in just a second, but I just wanted to mention, if you do want a certificate for this, because I know everybody needs them for credentialing now, we're just going to ask you to email us. Everyone here in the room should have had a certificate already, but if you're dialing in, just email our tphu_cdc_ims@health.qld.gov, and that'll will organise certificates for you. So I'm going to pass you over to Nancy now, and as I said, we'll do the questions at the end. Okay, thanks.
Thank you. Good evening, everyone, and thanks, Angie, for your very informative talk. For those that don't know me, I'm Nancy, and I'm part of the vaccine rollout program with the Tropical Public Health Services here in Cairns, working together with Nicole, that's sitting up there, and Kathy is also helping us. Our plan is Our aim and hope is to be a support to all our vaccine service providers through this COVID-19 rollout roller coaster ride that we're all going to be going through this year and onwards. We do know vaccines save lives every day. The COVID-19 vaccine is a vital and important preventative measure to help us out of this COVID-19 pandemic. So that's why we've set something up to help all you vaccine service providers that will be part of the rollout. So what we plan to present tonight will be what we can do to support all our vaccine service providers in TPHS. So we will touch on the national rollout strategy, the vaccine. I'll also discuss how we can ensure our vaccines, and not just our COVID-19 vaccines, but all other vaccines, remain potent and effective, and that's with vaccine management. And yes, we will talk about cold chain. Then we'll have some discussion about the Commonwealth specific education for the COVID-19 vaccine rollout, touch on APHIS, and then Nicole will be talking about the vaccine development and future advances. So the COVID-19 vaccine rollout is a Commonwealth-led vaccine program with the support of the PHN. The information, as we all understand, is very fluid and changing regularly. Even today, I'm sitting there updating my PowerPoints with all the information that's coming through. So the best way to stay updated is to check our website, check the Australian Government Department of Health website, and you can appreciate this is a big task. Everyone's really trying their best to roll out this program as effective as possible. So information will be brought to you via the website as quickly as it can be. I'd like to thank everyone who also has called and shared their experience thus far. So please give us a call if you do need it, especially those COVID-19 GP clinics who are doing an amazing job. They started this Monday. I'd just like to show an example of someone I spoke to yesterday from the COVID-19 GP clinic, one here in Cairns, who was entering her daily data reporting, and wow, wasn't that interesting and an eye-opener. 6 pages that she had to fill out every day, and she just needed help going through page by page, and even I wasn't quite sure what we were entering. So it can be a little bit misinterpreted, and I would encourage anyone that's using it, because the GPs are using AstraZeneca vaccine, and I really felt this was more for the Pfizer vaccination. So I really encourage everyone to provide feedback. It will help make improvements, and as the rollout continues to other GPs that do receive the vaccine, it's going to help everyone make this rollout nice and easy. There is an email on the website of that paperwork that she had to fill out, so I do encourage to go to that website, that email, and email any improvements you might see. There it is. Just this morning, the North Queensland PHN released their COVID-19 vaccine update number 14. So hopefully everyone is accessing the updates from the PHN. And with the new resource, there's heaps of resources there for GPs to support them. So definitely get in and have a look. One thing I really found quite useful was this vaccine query workflow sheet, because the PHN is getting a lot of phone calls and then having to triage to different areas. You can see on this worksheet all the different areas that you can refer people to if needs be. Like for technical issues with the COVID vaccine administration system, there's the Vaccine Operations Centre. We do know for AIR, you can give us a call. Kathy is more than happy to help anytime. But there is the AIR number as well, and the Proto account number. So there is lots of places you can refer people to, and there's details on how to contact them. So everyone would have seen this a few times. Our National Vaccine Rollout Strategy, which was announced by the Prime Minister on the 7th of January 2021, so this year, outlining 3 phases. This phase 1 commenced in January, and here in Cairns it commenced on the 26th, sorry, not January, it commenced in February. And here in Cairns it commenced on the 26th of February at the Pfizer Hub, just downstairs here at the Cairns Hospital. Downstairs, upstairs, upstairs. I don't know what floor I'm in. Yes, so we've already got on to some of our phase 1A receiving our second dose, which Angie did today, which is fantastic. Now, as of the 23rd of March, we've had over 3,700 frontline healthcare workers, quarantine and border workers, and subgroups for prioritisation that has been immunised right here in our Pfizer hub. So they're all doing a fantastic job getting that phase 1B immunised, phase 1A immunised. There they are. Phase 1B commenced on Monday here in Cairns. Currently we have 14 COVID-19 GP clinics here in our HHS. We have 10 in the Cairns area. We have 2 in the Tablelands area, and we have 2 in the Cassowary Coast area. The list of the COVID-19 GP clinics is available on the Australian Government Department of Health website, and it does get updated as more clinics are added to the list. So if you do want to find that list, it's quite a nice, long, lengthy list. Just go to the Queensland section and you will be able to find all the clinics that are currently listed as COVID-19 GP clinics. At the moment, the target is quite large for phase 1B. We're targeting the elderly that are 70, 80 plus, 70 plus, other healthcare, all other healthcare workers, the Aboriginal and Torres Strait Islander adults 55 years and older, and all adults with underlying medical conditions, including those with a disability and high-risk workers that are listed there. Those in phase 1B, if they'd like to book at a clinic that they don't usually visit, we do encourage them to first check their eligibility on the website. This is quite important because the clinics don't know you, and you should encourage people to check to ensure they are eligible for the phase 1B, and they can call the COVID-19 vaccine helpline. So these clinics will be asking if you have checked eligibility, especially if you're medically at risk, because again, they don't know those patients. So any information that they can get is very helpful.
We can't hear.
So you can find the eligibility vaccine checker that's listed on the Australian Government Department of Health, and that's the phone number as well that's down there, 1800 number. So as the year rolls along, we're going to plan on to phase 2A, which they plan to commence around late April, early May, and then the balance of the adult population in phase 2B, which is mid to late May. They do plan by October to have Australia's adult population vaccinated, those of us that want to be vaccinated. So it will be available for all, we just need to wait our turn. It is an almighty task and we really do need all hands on deck, and that's what we're here to do. We plan to support all our vaccine service providers to be ready if and when needed. Not only will our hospitals, medical centres and community health centres be involved, but so will our pharmacies. They're planning for the pharmacies to be involved from the phase 2A onwards. It's quite interesting because just recently I went to a talk held by JCU, which was very informative, and I was surprised to learn that in 2016, that was the first year that Australia allowed pharmacies to administer vaccines in the pharmacies. That year, there were 26 influenza vaccines administered in pharmacies, and all those 26 influenza vaccines were administered here in Queensland. So we are the beginning. We encourage all pharmacies to help with this rollout. It was a big year for pharmacies last year as well, especially with the COVID lockdowns. No pharmacies, they said no pharmacies were locked down, and I was very interested to learn that 3 million influenza vaccines were administered in pharmacies alone, which they say is equivalent to what GPs did. So we will see a lot of pharmacy input into this COVID-19 vaccine rollout. But again, we all need to be working together to support each other. And yes, they will be entering their data onto AIR. It is mandated. Kathy has been very busy helping all these pharmacies ensure that they do have their PROTA access. So they are also quite aware that they need to view the AIR register to ensure they know that the vaccines are there and to know that when dose 1 was given or dose 2. Okay, so just real quickly, a little bit of talking about the COVID-19 vaccines. Oh, my paperwork's gone. I should have brought it in. So we do know that Australia my little meat bits are gone, but Australia has got 3 vaccines, COVID-19 vaccines, Australia government, that they put a hold on, and the 3 that, well, we did put for 4, but the 4th one didn't go through, but we did put in for the Pfizer vaccine, the AstraZeneca vaccine and the Novavax COVID-19 vaccine. Currently, the TGA has provisional registration for registered the Pfizer vaccine for anyone 16 years and over, and the AstraZeneca vaccine for 18 years and over, but we're still waiting to see what happens with the Novavax. The 3 types of vaccines, there's the mRNA, is the Pfizer. That needs to be stored in -70 degrees, hence why we have our Pfizer hubs, and we are lucky that Cairns is one of them. Our AstraZeneca vaccine can be stored within 2 to 8 degrees, and this is what's been getting delivered to all our GP clinics and what pharmacies should be getting as well. And if Novavax comes through, that will also be in your GP clinics. What is interesting to see is the doses, the intervals that are needed. All of them are a 2-dose schedule. The Pfizer is a 21-day interval, as Angie did point out. The COVID-19 AstraZeneca vaccine is a 12-week interval. I put 4 weeks in brackets because it is approved to be given from 4 weeks if needed, but 12 weeks is the timeline that we do prefer. And we do know that studies have shown that it can be up to 24 weeks as per ATAGI. But the 12-week is definitely the optimal interval. And the Novavax, if it does come through, it is a 4-week, a 28-day interval. So we have pre-ordered, and we will be getting the 20 million doses of the Pfizer vaccination. As for the AstraZeneca, we've got 3.8 million doses that are coming from overseas, and the 50 million that are manufactured here in the CSL in Melbourne. Yesterday evening, the TGA approved the release of the first 4 batches of the Melbourne manufactured vaccine. So that's pretty exciting and quite important because we will have more vaccines available for all the adults that will be offered the vaccine. And if Novavax does come through, we have pre-ordered 40 million doses of the Novavax. What's important really again is, and I will mention again, is the minimum interval. As Angie did mention, the 14-day interval for COVID-19 vaccines, and that's with all vaccines. So not just influenza, but all vaccines that may be given to anyone. Recently, we did have someone get a Pfizer vaccine here in the Pfizer hub, and 2 weeks later had a tetanus-prone wound and was given an ADT. So they then had to reschedule their second dose and have that 4-week interval instead of the 21 days. So it does happen, but we'd need to know about it. So checking air and being really on top of the vaccine and informing your medical practitioner that you've received a vaccine is really important, and it is important to let our clients know when they're receiving a vaccine that they should, if they do need medical attention, they should inform whoever they go and see that they did recently receive a vaccine in case another one's given. For the age group that we got in 1B, we really need to look for that Zostavax and pneumococcal vaccinations, because that's for our elderly, and the pneumococcal not only for the elderly but for the medically at risk that are also eligible to get their vaccine now. Currently, both the vaccines that are available now in Australia, they induce the immunity to COVID-19 by telling the body how to target the virus. They're both very effective, but they both do this in different ways. They both provide excellent protection against severe COVID-19 disease, meaning that if you were to ever get the COVID-19 virus, your body is better prepared to fight the illness and reduce its severity. And that's the important part, it's reducing the severity of the illness. It is, however, important to point out that even after vaccination, the Queensland government still encourage everyone to continue to do what we've been doing during this pandemic, maintain, good social distance, and our great hand washing. It's just been wonderful to see all this lovely hand washing. Another thing to note is that most of you will, there will be another vaccine in your fridge. Last year we saw Bexzero enter most of our GPs' fridges. In 2016, we had the Zostavax in your fridge, so your fridges are really full. Now we're putting flu vaccines in there, and then most GP clinics we do expect will be getting some stock of COVID-19 vaccines. So really ensure that you've got great vaccine management, which is what we're going to discuss now. Our COVID vaccines are very precious and scarce, and as with all vaccines, they are sensitive. Therefore, we really need to ensure effective cold chain is maintained. It's really important that we protect our vaccines, because these vaccines will then protect our community. There's no point giving a vaccine that's no longer potent. We're not protecting our community. Even with good procedures and protocols, cold chain breaches can still occur, and they do occur. I mean, we've recently had a fantastic low pressure system decide to shock us with all this 100-kilometre winds and knock lots of people's powers out. Everyone did a great job trying to protect themselves, because nobody really expected to get that much wind, and had their processes in place. We had vaccine providers that had backup battery systems, so they left their vaccines in the fridge, which is great, with the UPS connected. However, the UPS only lasts a few hours, probably 4 hours, and those vaccines obviously did eventually get warm as our power was off for a lot longer than 4 hours, especially in the south side. We also had people pack the vaccines into coolers, which is fantastic, but again, the ice starts to melt and we need fresh ice bricks to swap them over. So it was a really good exercise, especially for those that have uninterrupted power supplies, our UPSs, because you got to learn how long your batteries are going to last for. So if you need to update your protocols to ensure that we know when we need to then look at our vaccines again. That is our other main thing, updating our protocol yearly new staff members, when they come along, they should be aware of these protocols, any changes to new equipment and maintenance. We should be updating our protocols. Myself and Nicole are very happy to review any protocols, and we did send out a survey to all our GP and immunisation providers regarding your vaccine management, and really would love to thank everyone that has replied. We will be drawing that prize tonight. Kathy will. We'll let Kathy do that since she's been collating all my data. And we'll have to watch that space for what results we get back from that. But we really have done quite well with our vaccine management. So again, vaccine management essentials is keeping your vaccine management protocol updated. Ensuring you have enough coolers to hold the vaccine stored in your purpose-built fridges with sufficient ice bricks and insulating materials. Those GPs that did have the power outages, and even if they did pack them into the coolers, they didn't have any influenza vaccines in their fridges. So it was definitely a perfect run to go, yep, we definitely have enough coolers because we still have another esky in the storeroom, so our flu vaccines can go in that. But if you didn't, now's a great time to go to that practice manager and say, maybe we should buy another cooler or keep one of those styrofoam eskies. So it's all very good learning experiences that we go through. We also need to make sure we have enough battery operated min-max thermometers, at least one for each cooler, at least. More is better. And these min-max thermometers need to be slush test at least yearly or more often if they're starting to play up. And the batteries changed 6 to 12 months or more frequent if required. We encourage data loggers, as per the National Vaccine Storage Guidelines. It does say you do need a data logger, and we really do encourage data loggers to be used. They're great during power outages, so we can see what times those vaccines were out of range. The data logger should be set for 5-minute continuous recordings, and the battery change and recalibration every 12 months or as per manufacturer's instructions. We do encourage everyone to record their temperatures on the Queensland Health Min-Max chart. We have plenty here available in the back there. If there's none on the tables, let us know, because we do have more in boxes. And don't know what's happened with that screen. Oh, back on. And if anybody needs any logbooks for their eskies, just come and grab that off us as well. You can order that with your vaccine order forms, but they're great and quite self-explanatory on how to record your temperatures in your coolers. Just some pictures of the vaccine resources that we have, our min-max charts, our emergency sticker for your coolers. We do have stickers for the fridges and for PowerPoints and electricity box. You know, we've had cases where they come and do some electrical work and just unplug the fridge, or even the cleaners come and unplug the fridge. So we do love to have our PowerPoints up nice and high where it's not easily accessible, and having a sticker there. So if you need any stickers, just let us know. We can send them out to you guys as well. Training, this is the online, the free vaccine management online course, which is available to everyone. We do recommend you offer it to all new staff and at least do it annually for existing staff. It is a really great resource tool. That's the website you can get it from. Just search immunisations, because there's a lot of courses on there. Search immunisations and select course 2. So there is 4 courses, course 1, 2, 3 and 4. Go course 2. If you want to really do another course, you can do course 1, but definitely course 2 is the one we really want you to do. Another great way that you can practice and train with your cold chain is just to keep all the empty boxes of your vaccines that you've used for a month, and then at the end of the month or 6 weeks later, have a practice run, pack in a cooler, just for fun, you know. It's it's a good exercise, and you can work out how many ice bricks your cooler needs and how it all works with that size esky that you have, because every cooler and esky is different and will require different bricks and how it works. We do need to also plan and prepare for the COVID-19 vaccine for those that are COVID-19 GP clinics or those that want to be COVID-19 GP clinics. You do need to complete the Commonwealth education. So in partnership with the Australian College of Nursing, the Australian government developed this free accredited training module. The training module is mandatory for anyone doing the COVID-19 vaccines and is at no cost. The thing is, it's 6 modules, and it's really interesting, shall I say, the quizzes, but I'm sure you can get through it. Yes, there is some curly ones there to trick us all, but yeah, it's only 6 modules only. And of course, there are a few extra modules depending on what vaccine you will be administrating. It is also recommended and mandatory for non-clinical and administration staff depending on your role. So the Queensland COVID-19 did a vaccination training matrix. There it is. There's our 6 core modules. So if you receive, handle, administer and prepare, it's mandatory to do all 6. And then depending on what vaccine you'll be working with. If you receive, handle or prepare, again, it's module 1 to recommended module 3 and module 4. If you receive or handle the vaccines, module 1 and module 2 and recommended module 3. So receive and handling could be your admin officers that receive the vaccine, the eskies that come through, and if the nurse is busy, some of them are even trained to put them straight into the fridge. So that it is mandatory for them to also do this course. And clerical, so even if you're just making your bookings, it's mandatory to have module 1 and module 3. So the additional one is the Pfizer, the AstraZeneca, and we hope eventually the Novavax module. Now I'm going to talk about adverse events following immunisations. More importantly, the COVID vaccine. As we know, everything has a risk. Nothing is risk-free. Even driving to work every day, there's a risk. Going for a swim in the lovely Palm Cove, we have a risk of getting stung by jellyfish or crocodiles. There's a risk for everything. So an adverse event following immunisations, however, is any untoward medical occurrence following an immunisation. So this can happen within minutes, hours, days, or weeks. After you have completed an AFI form, it will then be further investigated and to see the suspected association with the vaccine, because sometimes the relationship cannot really be clarified, but they are investigated. The Therapeutic Goods Administration are responsible for monitoring the safety of all vaccines approved in Australia, and they do monitor the COVID-19 vaccine. I'll give you more information soon because I've got more details. Every report is valuable and helps build a detailed safety profile of the vaccine. So if we do have anyone that's come to your clinic saying that they've had a reaction post a COVID vaccine or any vaccine, it is under the Queensland Public Health legislation notifiable. So you do need to complete that AFI form. It is a notifiable condition. In Queensland for the COVID-19 vaccine, so I am going to talk about the COVID-19 vaccine, for Queensland health staff, the AFIs are reported via the COVID-19 AFI portal. For all other providers, they need to complete the COVID AFI PDF form and email it to COVID AFI email. This PDF form can be found on the Queensland Health Government website. It looks very similar to the adverse event following immunisation form that we do for all other vaccines. It's just slightly tailored for the COVID-19 vaccine, and it is a different email that you send it to. So the email is on the form. Make sure we have a look and send it there. But again, you can give us a call and we can talk you through it if need be. So this is what I was doing late this afternoon because it didn't come in till this afternoon, but the TGA does release weekly COVID-19 vaccine safety reports, and I wanted to get you guys the most up-to-date information. This report was released today. So the most common adverse events that we've had for the COVID-19 vaccines as of today has been headaches, fever, muscle pain, fatigue, and nausea. As per the TGA, there's been over 281,000 vaccines administered, and a total of 1,508 APHE reported. So these are what have been reported to the TGA. So not all states and territories, it's mandatory to report APHEs, but in Queensland it is. So just remember that, but yeah. So that's a reporting rate of about a reporting rate of about 5.4 per 1,000 doses. So everyone can check every Wednesday. It's like my highlight. You can go in and have a look at the TGA report and see how it's looking. Especially with now the AstraZeneca that's come along. I think we did have, I think it was the last one that I had was about 4.9, so it rose slightly. And we don't know if that's because everyone's a little bit nervous. And it is something I'll quickly mention, and that's the hot topic that we had a few weeks ago, being the blood clots and the AstraZeneca vaccine with the COVID-19 AstraZeneca vaccine. The TGA did bring an update for that, so everyone can find that on the TGA website. That was dated the 19th of March. And they found that the number of blood clotting cases reported after vaccination, both in the large clinical trials undertaken prior to vaccine authorisation here in Australia and during the rollout of vaccination programs across the world, they found was lower than expected in the general population. An example is in Australia, we get about 30,000 thrombosis episodes per year, and in a population of over 25 million people, that's on average 1.2 per 1,000. Several countries in Europe suspended the rollout of the AstraZeneca COVID-19 vaccine after 37 cases of this rare blood clot from 17 million people that were vaccinated. That's a rate of about 0.2 per 1,000 or 1.1 per 5,000, therefore lower than what is expected in the general population. It was really good that they do investigate everything, but in order to suggest that there is a risk, the vaccine incidence of the new event, which is the COVID-19 vaccine, must be bigger than the relative risk of the population. This is not the case as seen in the numbers that I mentioned. Ausvac safety. So I'm hoping most of you have heard about this, but if you haven't, it's a national system for monitoring vaccine safety in Australia, led by the National Centre of Immunisation Research and Surveillance. It does this by using de-identified data reported directly from people receiving the vaccines via surveillance tools, the SmartVax or Vax Tracker. And in Queensland, it's a SmartVax. Currently, you can go into Ausvac Safety, again, another fun thing that I like to do, and see what vaccines are under surveillance. We've got the influenza vaccine, the pertussis vaccination, HPV vaccine, the zoster vaccination, meningococcal B vaccine, meningococcal ACWY, and now the COVID-19 vaccines. For the COVID-19 vaccinations, on day 0, you asked to be participating into the Ausvac Safety in your immunisation clinic, and upstairs, the Pfizer hub do have little scanning things that you can get involved in Ausvac Safety. Then on day 3, you'll get your first survey. about your vaccine to see if you've had any adverse events. On day 8, you get your second survey, and then 6 weeks later, after your second dose of the vaccine, your final survey. So it's all done by SMS or email. It is a short survey, and it is all de-identified information. What it does is give us this great little information charts that we can then show our clients and the general population, and you can even advise them to go into Ausvac Safety and have a look to see how the vaccine safety is going. So as of the 21st of March, they've had no safety signal detected, and they've completed over 105,000 surveys. So about a third of the people vaccinated. Or that's what was said, sorry, and then 67% responded, a bit less than a third. But anyway, we did find that about 54% had no adverse events, 45.2% reported an adverse event, and 1.1% of those that participated in the survey reported visiting a doctor or an emergency department. So that's our main thing, is, you know, if we needed to seek medical attention. It's really good to see how this is tracking as well, if anyone else is interested. Those GPs that may be interested in linking into this great monitoring system, you can register your interest at SmartVax. It involves installing the SmartVax software. It's free. It runs in the background of your practice software. It increases patient satisfaction. We do have patients that are like, oh, I can't see my doctor, but I'm a bit worried, and they do get that text message, so it just gives them that one little bit that someone's there checking up, and they don't ignore the text messages if you do say you've had an adverse event. And the practice will be automatically notified if the patient reports a serious reaction. I was hoping to print out some of the leaflets regarding what general practices can do to join up. If anybody's interested, just send us an email or give me a call and I can email that out to you. Now, thank you so much for all your time and listening to me today. Again, we're going to hold questions till later. Now I'd like to invite Nicole. Thanks, Nick.
Hi everyone. So we've been vaccinating using the COVID-19 vaccines for a couple of weeks now, and one of the really strong messages that we're getting through both traditional media and social media is just how quickly these vaccines were developed. As Angie said at the start of her presentation, 6 months into this pandemic, we were all screaming for vaccines. We couldn't wait for them to be here. Now that they're here, we're seeing an increased rate of hesitancy and in some cases declination based on the safety concerns about the vaccine. So I'm going to cover quickly how we got them so quickly and what the future research is showing us is going to happen in terms of COVID vaccines. So in October last year, RACGP released a really interesting paper that suggested that we need between 55 and 82% of our Australians to be vaccinated to get the herd immunity we need. So the experience has taught us that it probably has to be a little higher than on the lower side of things. So we are seeing about 10 to 15% of Australians say they will not get the COVID vaccine. So our margin for error is looking smaller and smaller by the day. The number one cause of people saying they will not get the vaccine is concerns over safety. The genetic code for COVID-19 was released to researchers on the 11th of January 2020. The first known person to be vaccinated outside of a trial was on the 8th of December 2020. That was the nursing home patient in the UK. That's a little less than 11 months later. This is not the first time that drug manufacturers and scientists have been asked to respond and make a vaccine in response to a pandemic over the last decade. We asked them to do this for H1N1 influenza, Ebola, Zika, and now SARS-CoV-2. The SARS and the Zika outbreaks ended before the vaccines were completely researched and produced. Just like with most things in healthcare, that cost money. A lot of money went into developing particularly the SARS and the Zika vaccines. So when there was no longer a demand for it, that money went elsewhere. The manufacturers and the scientists had to absorb that cost, and it actually delayed future vaccine development. However, these sideline vaccines proved absolutely invaluable when it came to COVID, particularly the SARS one. Data from the preclinical development of the vaccine candidates for SARS and MERS enabled the initial step of vaccine design for SARS-CoV-2 to be essentially admitted. We already had the data. We already had the safety profile. We knew how the human immune system was going to react and what potential side effects we could expect to see. In many cases, the vaccines that we had for SARS and MERS were simply adapted to fit SARS-CoV-2. The information was there. That helped immensely with our timeline. This particular graphic was released by the RACGP as well, and it compares traditional vaccine development to the SARS-CoV-2 vaccine development. Traditional vaccine development takes between 10 to 15 years and costs between $200 and $500 million. And that's US dollars, that's not even Australian. It is a very structured process. The companies take one step and they pause. They analyse the data, they determine if it is going to be a worthwhile candidate and if it is worth future financial investment. If they decide to proceed, they'll go do the next phase, pause and analyse the data again. That's why it takes so long. Usually when companies make a new vaccine, they're not just working up one candidate at a time, they'll do multiples. Because there's absolutely no guarantee that any one vaccine candidate will actually serve our needs. What happened last year, in addition to having some of the safety data already there, to having some vaccine candidates already there, is they ran multiple steps at once. This was a massive financial risk. So what we saw is companies actually making vaccine before phase 3 was complete. If we think about what happened with the UQ trial, they had started making vaccine and then they were told that it was not going to be suitable to our needs. They had to abandon it and away went all of that research money. The reason they did that is so that when we granted these companies approval to use their products, they had stock ready to go. As soon as the TGA approved both the Pfizer and the AstraZeneca vaccine, we were using them weeks later, not months later as we normally would have. That's why it happened so quickly. That's why we got vaccines in a little under 11 months. We used information we already had. We used vaccine candidates we already had. And the companies took a lot of risks in running multiple trials at the same time and making vaccines that they could not guarantee would ever be put into clinical use. As of March 20, 436 million doses of COVID vaccines have been given worldwide. Research is not slowing down. If anything, it is increasing. So we have 2 vaccines approved for use in Australia. We're probably going to get the 3rd one with the Novavax. There is no guarantee we will stop at 3. There's over 250 other vaccine candidates currently being worked up across the world in various stages of development. So that data is correct as of the 19th, as per the GIPI. One of the most important players in the research into the COVID-19 vaccines is the Coalition for Epidemic Preparedness and Innovations. That's too hard to say, so I'm just going to call it CEPI. CEPI is a coalition and a global partnership between public, private, philanthropic and civil society organisations. The whole aim is to develop vaccines to stop future epidemics. CEPI is based in Europe, but Australia and New Zealand have both contributed money towards this goal. They've played an absolutely central role in the response to the global COVID-19 pandemic and have created the largest profile of vaccines in the world. They're also helping with what we call COVAX. They are helping to make 2 billion doses of vaccines available to 190 countries internationally that are under-resourced and not able to pay the drug companies themselves. So we are seeing some COVID vaccines being made available to places like Papua New Guinea through the COVAX program. I have some really exciting research coming up. So on the 18th of March this year, CEPI and the University of Hong Kong announced further development into the university's intranasal COVID-19 vaccine candidate that's based on a live attenuated influenza virus. The reason they want to do this is by giving the vaccine intranasally, we are provoking that immune system response. We're generating those antibodies in the respiratory system, so where the virus enters a human. That same mode of vaccinating, targeting one specific organ system, we've also used in polio. So polio is an oral vaccine because the disease itself is ingested. So when we give the vaccine orally, we're mounting that primary immune response in the digestive system. By the end of March, CEPI will put out a call for proposals for $200 million of funding, and they want an all-in-one coronavirus vaccine that covers not only SARS-CoV-2, but the original SARS and MERS. So SARS-CoV-2 is the 7th coronavirus we've identified that causes human illness. The main concern going forward is the next coronavirus we encounter is going to have the infectivity of what we know as COVID-19, but the case fatality rate of something like MERS. So we've seen very advanced, what we thought were secure healthcare systems be completely overwhelmed by COVID-19. Case fatality rate isn't that high. We had the infectivity of COVID-19, the fatality or even the morbidity mortality of MERS. I don't know if there's a healthcare system in the world that would be able to tolerate that. So they want to come up with an all-in-one generic COVID vaccine to try and protect us all. Their interest isn't just in COVID. CEPI want to put in place protocols so we can mount new vaccines within 100 days. So this is not going to be the last pandemic that we see. Their goal is that when the next pandemic comes along, in just over 3 months, we will have a vaccine to protect the world. It's an incredibly ambitious goal. They want to use technology we already have and basically just have generic vaccines sitting there. So once the genetic information for these epidemics are released, they can incorporate that genetic information into the new vaccines and really speed up the process. All right, so that brings us to a close.